Hello everyone, this is 18th MCQ. So in the stem of MCQ, a toddler is presented with delayed development and ataxia. Sibling is also having the same clinical features and in examination having the truncal ataxia, hypotonia and decreased deep tendon reflex. These features suggest that cerebellum is involved. So ataxia with hypotonia and decreased DTR and especially the truncal ataxia means the cerebellar vermix involvement is there. Now in the MRI, molar 2 sign is present. So what is the diagnosis? So see the options. First is Dandy-Walker malformation. Second is Arnold-Chiari malformation. And third one is Joubert syndrome. And last one is Refsum disease. All causes the cerebellum involvement. So let's see all the options one by one. Now in the first and second option, Dandy-Walker and Arnold-Chiari malformation, onset of symptoms since birth. So child will have the delayed development since birth. Now in the progression, it is non-progressive. These two are the congenital anomalies of posterior fossa. Dandy-Walker malformation characterized by these three characteristic changes: agenesis, hypoplasia of cerebellar vermis, cystic dilatation of fourth ventricle and enlargement of posterior fossa. So this is the normal MRI and this is the MRI of Dandy-Walker malformation. Here you can see this is normal cerebellar structure while it is agenesis or hypoplasia of cerebellum present, and dilatation of cystic dilatation of fourth ventricle is there and enlargement of posterior fossa you can see in Dandy-Walker malformation, not having molar tooth sign. So this option is ruled out. Now the option B, Chiari malformation, in which patient will have the deformity of posterior fossa and hindbrain, cerebellum, pons, medulla will be involved. So patient will have the myelopathy, cerebellar sign and cranial nerve deficit. While in the our MCQ, they have suggested all the cerebellar sign, not the myelopathy or cranial nerve involvements. So myelopathy characteristically dissociated sensory loss present in Arno-Chiari, loss of pain and temperature and preserve fine touch and proprioception, and motor weakness also there. In cerebellar sign, patient may have ataxia, dysmetria or nystagmus. In cranial nerve, 9th, 10th, 11th, 12th cranial nerve involved due to the direct compression of cerebellum and medulla at foramen magnum or from syringomyelia or syringobulbia occur in Chiari malformation. So this option is again ruled out because patient is not having myelopathy and cranial nerve involvement. An MRI brain is also not suggesting the changes of posterior fossa in this way while the showing the molar tooth sign. Now in the C option, Joubert syndrome, onset of the symptoms will be during infancy, not since birth. It is non-progressive and patient will have the truncal ataxia, hypotonia and decreased DTR as mentioned in our MCQ. It is due to the agenesis of cerebellar vermis. Joubert syndrome is autosomal recessive. Cerebellar vermis hypoplasia characteristically present in this, and molar tooth sign in MRI brain is characteristically present in Joubert syndrome. So the right answer for our MCQ is C. So what are the characteristic clinical features in this syndrome? Patient will have the global developmental delay, hypotonia, ataxia, breathing abnormality, apnea, hyperapnea which improve with the age, abnormal eye movements, nystagmus, strabismus, ptosis, oculomotor apraxia, other congenital malformation as progressive retinal dysplasia, CHD, congenital heart disease, microcystic kidney disease, liver fibrosis, polydactyly, tongue protrusion, soft tissue tumor of the tongue can be there in this syndrome. So what are the MRI changes in Joubert syndrome? Here you can see the cerebellar vermis hypoplasia is present and deep interpeduncular fossa visible over here, while in the normal MRI it is normal, while in the Joubert syndrome it is deepened. An elongated superior cerebellar peduncle is present in Joubert syndrome while not in the normal MRI brain. So characteristic molar 2 sign you should keep in mind present in this syndrome. So the right answer for our MCQ is option C, Joubert syndrome. Now about the option D, Refsum disease. It is the uh, genetic and degenerative cause of cerebellum involvement. Onset will be chronic and it is progressive. Similar to the ataxia telangiectasia and Frederickson ataxia, Refsum disease is a degenerative cause of cerebellum involvement. For further reading on this topic, you can go for ataxia in children on this YouTube channel. Thank you so much.